Welcome to the American Institute of Healthcare Professionals, Inc. Videogram on the nature of addiction. This is a basic video that we're going to present to introduce our program, our certification program in substance abuse counseling. And it also will cover some basics on nature of addiction and so forth. I myself am not an instructor for these courses. Dr. Shear, Dr. Pistolos, and Dr. Flary teach the courses for this program. So I'm in a way just introducing the program here in this video, and I'm also going over just a little bit of basics just to give some substance to what addiction is. And addiction, for the most part, on this slide, we look at that it's the condition of being drawn to a particular substance or activity and then becoming dependent upon it. Dependent upon it in terms to function. You're not able to go a day without this particular substance or activity, where you experience social or physical withdrawals from it. Most of these are substances and drugs, but they can also be actions, sexual addiction, a gambling addiction, a gaming addiction, or any type of high risk activity. Most substances fall under the titles of stimulants or depressants. Most individuals become addicted to alcohol, smoking, vaping, marijuana, cocaine, heroin, meth, and the misuse of opioids and various pills. With drunk driving alone, 10,000 people die a year because of this. Alcohol, while legal, is still an issue with this because so many people lose their inhibitions to avoid dangerous activities. So we have individuals driving drunk and so forth. And we also have a lot of teenagers who are under 21 misusing this, and it causes a lot of friction within family structures. We also have major issues with cocaine and heroin, higher tier drugs that are more dangerous, more addictive, and very life-altering in terms of destroying careers, families, and even lives themselves. Opioids is one of the most recent ones that is on the rise. People are becoming addicted due to pain pills being prescribed and so forth. And individuals take the pain pills, and then what they've become is addicted to the need of them, and they're constantly looking for these pills. And the misuse of these pills is leading to, again, a lot of fractures and in families, leading to divorces and so forth. In regards to miscellaneous pills as well, we're seeing an increase in addiction, especially among teens at various parties. With pills alone, 70% of overdoses in the United States are due directly to opioids or the misuse of prescription pills. And this is why the states and the government and pharmacies are becoming much more stingy in what is given out, the amount that's prescribed by doctors and physicians and so forth, to try to stunt this epidemic that's occurring in many communities. When we look at addiction, there's various reasons why. No one wakes up in the morning and wishes to become addicted to a particular substance or activity. So there's multiple factors that can lead a person down this dark road. Number one, depression or any type of loss, stress, and poor coping mechanisms to that stress. With teenagers, peer pressure, especially with alcohol and taking pills. Home and family life, the availability of drugs to help cover up problems at home and family, life, and as well as school performances. For a lot of teens, they become addicted maybe to Adderall or things like that to try to enhance their performance. And finally, if you look here, hereditary. Some individuals can binge drink throughout college and never become addicted, although they did display a addictive type of characteristic during that temporary field, but they don't become what you would call physically addicted because it's not within their family history. Those with a family history of addiction need to be extra careful in regards to misusing those substances because they're very likely to become addicted eventually. So when we're discussing substance abuse with clients, when licensed counselors are working with them, there's a lot of things that need to be asked in regards to discovering the extent of the addiction or how serious it may be. For example, questions of how long have you been taking it? How much do you take at a time? Do you have an inability to manage the substances that you're taking? Are you losing time when you recover? Are there blackouts? How strong are your cravings? Is your time management being affected? How are the relationships that you have with other people? Are they damaged despite the usage of the drugs? Are you neglecting other activities in life that need to be done, work, school, or other responsibilities, parental responsibilities, and so forth? Are you continuing to use the substance or perform in the activity despite the dangers? And as you continue to take the substance, are you developing a higher tolerance where you need more to achieve the same end? And how are the withdrawal symptoms after you are going through the process of getting the drug out of your system? How severe are they? So if you look at all these questions and you put it together, they paint a picture of whether or not someone is facing addiction or not. And they're very important guidelines that licensed counselors and substance abuse counselors use to determine the extent. Other important questions are, can you stop? You need to ask yourself. How long does it take you to recover? How dominating are these cravings? Are you missing school, work, or family functions? How much does it take to make you feel good? How about this? Have you ever stolen money from a family member or a friend to fund your habit? Have multiple friends expressed concern over your life? And have you also done dangerous things while under the influence, driving or other illegal activities maybe that you normally wouldn't do? And do you feel you're addicted itself? So once you start to feel that there's an issue, some list a 6-stage recovery process. And during this recovery process, it's not just in one night overall. For some, it's a lifelong process, but it's all about forming new habits and overcoming the chemical dependency in your life. And during that pre-contemplation period is where you start to have the questions that we just spoke about on the previous slide, where the individual who is addicted begins to become aware that this addiction is a problem. Even though they might minimize it, they still see a potential issue, which would lead you to the second stage of contemplation, where the issue of a problem is completely accepted. There is a problem, I'm aware of it, but they might not be ready to go to the next stage of doing something for it. And this is where preparation starts to come, where the addicted individual sees that there is really no benefit in the cycle of life that they're living, and they want to come to a point of action. And in action is where we see the 12-step process, where many go to centers, rehab centers, also go into Alcohol Anonymous programs and so forth to take the actions necessary to create that change. And of course, then comes probably the hardest is maintenance of this change, avoiding the temptations, especially temptations that in the past led them down the same route as they were before. So identifying those triggers to their addiction and avoiding those, and staying clean, staying sober, avoiding the addicting habit that might be tormenting them. And finally comes the final step of termination itself, where the action is no longer part of your life. A new career has been resumed, academic success has occurred, overall health is there. So a new habit has formed. However, the fact that addiction is always lurking, that chemical dependency is always lurking, is something that can very easily send anyone into relapse. And avoiding relapse is always the key, but it's also the most difficult. The American Institute of Healthcare Professionals offers a substance abuse counseling certification, as I said in the beginning of this short video. The program is open to qualified professionals who might be seeking a 4-year certification in substance abuse counseling. The program itself is online and independent study, and the courses are authored by Dr. Pistelos, Dr. Shear, and Dr. Flaherty. If you would like to contact us regarding the substance abuse certification, you can go to the link below. And you can also go to the request for information link, which we have right there. Also, if you would like to contact us, our phone number here is 330-652-7776. Again, that's 330-652-7776. And the email is info@AIHCP.org. Again, the program is the Substance Abuse Counseling Certification, and it is open to qualified professionals in healthcare, as well as those in behavioral health who are looking to help others overcome addiction. I'd like to thank you for listening for this video, and if you have any other questions, please give us a call.